of the surgical profiloplasty using implant and ostectomies for the lower third and the middle third of the face. No conflict of interest. For me, profiloplasty is the way to obtain a balance, harmonize on the face, not only thinking about the nose, is usually we think about that, at the same time in the malar area, the chin, and I add to the harmonize for the face, the gonial area too. Thinking always in these two planes, Gonzalo Ulloa and Stephen plane and wicked planes. The first one you need to obtain by cephalometry or RX and give you the real position of the combine or the balance between the mandibular and the maxillar bones. And the other one, the wicked plane, give you the position and the relation between the soft tissues, the tip of the nose and the chin. The first one gives you the real definition and the real diagnosis of angle 3 or angle 2. This kind of real ugly or difficult situations, as you know, need to perform another kind of complex osteotomies and DOG, osteogenic distractions. But when you have this kind of diagnosis, of course, you need a multiple-purpose hospital because you need to perform ovigescent ostectomy, gradual osteogenic distraction, only for one osteotomy, and you need at least 1 complete year of a work or orthodontic. It's a longer surgical procedure, complex intubation. You have a skill anesthesiology, and more risks, more complication, and more expensive. The wicked plane is easy, faster, and you can do it at your own office with a simple ruler. You can see the relation between the nose and the chin, and the lips never need to touch the rule. Or with this device, this open mouth device, you can see here, for example, a real angle 2, and well, as I said, you need to send to a maxillofacial surgeon or another kind of surgical that can perform this procedure. These are my tools. I use precast silicone implant, covered silicone block, precast polyethylene implant, precast polytetrafluoroethylene implant, silent osteotomy, forward and backward, ostectomy, fatty filler, and cystectomy filler. I'm going to show you some examples of each one. Part of my tools, of course, the precast silicone implant. You know about that. You know about the precast polyethylene implant too. And you need to be familiar with this kind of tools if you want to perform the use of polyethylene implant, because you need to add osteosynthesis fixed with a rigid osteosynthesis. Some technical details, for example, you can carve in your prosthesis as you want. You can cut it, even if it was a polyethylene implant or it's a silicone implant. You can reduce the size, or you can put this indentation for the nerves, for example, and always give the clue and the advice to immerse the prosthesis in antibiotic solutions. And always leave some wool, some tissues in the both sides of the wood to put the stitches without any extrusion. After that, you perform the pocket. Always some superior pocket. You need to put the implant in contact with the bone. And after that, as I mentioned, rigid osteosynthesis with drills and screws, as you can see here, for this polyethylene implant on the chin. And again, when I add profiloplasty and ostectomy, as you can see here. 3 steps: the pocket, the implant, and the rigid fixation with the screw. And in some cases, if you don't have a correct plan, or you have any mistake, or the patient have a real asymmetry of the face, you can complete the treatment using, as all of us, fat graft. It's important for me to use this adhesive elastic bandage and chin guard to be sure you don't have any kind of movement implant during the first 2 weeks. Some cases and results, we start from lower to highest. First, only the precast silicone implant, adding to this case of course, you give the indication of rhinoplasty, but don't forget the relation with the chin to obtain this good result in a profile view and in a half profile view. In some cases, the retraction of the chin is worse. In these cases, you need to cover the silicone block to obtain a bigger size of implant, as you can see here. Or in this case, again, great retraction, but with good angle 1, you have not only the implant at the same time rhinoplasty. We go forward. In this case, we decide a precast polyethylene implant because it's a complex case. The patient have a displaced chin prosthesis and ask me to have a solution. First, I take out the implant, and after that, I put this precast polyethylene implant with rigid fixation. And here is the before and after of the same patient. We go forward. We have not only the implant and at the same time fat filler on the malar area and the gonial area to make a wider mandibular and more protrusion of the middle part of the face to get improved in this the face of the male patient in the half profile view. And the boyfriend of this other patient said that required me to be again so handsome that his boyfriend. I performed the same procedure on him. And here is the result. We were more complex and complex. In this case, we had different kind of implants, not only in malar area, chin, and gonial area, as you can see here. To try to give a solution to patients who have lower volume in all these areas that I mentioned. Here is the rigid fixation on the gonial area, as you can see here, and the silicone implant with the fixing with the only stitch in the chin and in the malar area too, to obtain this great balance over these patients. And of course, I add a rhinoplasty to complete the harmonize of the face. Again, a little more complex. We have different kind of polyethylene implant and a fat filler on the malar area to obtain these good results in the profile view and the half profile view. And in some cases, we have a lot of volume and need to reduce. Just in this case, again, look at the cephalometry. The patient have a good angle 1, but have an excessive chin, a great protrusion of the chin. That's why this is my plan, my surgical plan, and this is my result, and this is the proof that the procedure that I made, and I obtained this reduction of the chin, only in the chin. Again, another great protrusion of the chin, the plan, the surgical plan, and my result. This is during the procedure in the way I take out the excessive bone of the chin. And this is step by step. I first perform little hole with a drill. After that, with the ostectomy, I made the line and take out the excessive of the bone. And after that, with the Miller, I be sure that I don't have any sharp edge to avoid to touch it and have a discomfort of the patient. This is my result. The same patient that I showed you before during the procedure. Another case with a real protrusion of the chin. And again, when I add a rhinoplasty and chin ostectomy. Difficult case, I want to show you in which cases I add a bone graft. As you can see here, is the weak chin, a real weak chin, in which one part of the ostectomy, I use it as a bone graft to have this great result in the profile view. In some cases, I need to reduce the volume. Again, not only to add, to reduce the volume. In this case, I perform an ostectomy of the gonial area, and bichectomy, I reduce the soft tissue too. During the procedure, here is the way I cut the gonial area and the way I make an extraction of the excess fat cell of the beachhead malar beachhead fat. And here is my result with more feminine face for these patients. Complex combination of procedure. I want to say you why I decide that, because I have this problem, hemifacial microsomy with left cheek fat atrophy, gonial under projection, displace of the chin implant, right cheek fat excess, right neck fat excess, and a mamelon. That's why in the right part of the face, I need to reduce the volume, but I need to add volume to the left side of my patient. This is the problem in the 3 views of the face, and this is the solutions. You can see here the way I can obtain a reduction of the volume in all the right side and increase the volume in the left side. In the profile view, in a complete profile view, and here is the proof of the volume that we obtain with the vector system. In some cases, I have a logical doubt, my patient too, that's why I offer the water test. It means I use saline solutions in my office and take a before and after photo. If a patient, I agree with the result, and I agree with the result too, well, in some cases, I avoid a surgical procedure and only give a solution by injection. Just in this case, I use a syringe to obtain this balance in all the face of the male. Of course, we need to mention some complications as infection and extrusion. When you have pus around the prosthesis, forget it, you need to take out because there are some other kind of solution only to take pills, antibiotic pills. Take-home message that, in the final of my presentation, profiloplasty is a way to obtain a better harmony on the face, on face procedures. Take into account the wicked plans because it's easy to perform on your office at the same time with the device to open mouth and to show the real angle of your patient. If you have angle 1, go ahead. If you have angle 2 or 3, well, think about it, another procedure. And be familiar with different kind of material and surgical technique to improve the chin, malar, and gonad area too. I invite you, of course, as part of IMCAS Board, into the IMCAS in Brazil. Thank you so much for your attention.